The World Health Organization and the Centers for Disease Control and Prevention recommend that infants be exclusively breastfed for 6 months. Breastfeeding, along with appropriate complementary foods, should be continued for a minimum of 1 to 2 years. Most expectant mothers realize that breast milk is superior to infant formula and that it is the best way to feed their babies. Yet many women are not meeting their own breastfeeding goals, citing that they are not receiving enough guidance. In fact, more mothers would start breastfeeding and continue to do so for longer periods of time if they received accurate information and appropriate support. For over 25 years, the International Board of Lactation Consultant Examiners has been the global authority that determines the competence of practitioners in lactation and breastfeeding care. Practitioners who hold the International Board Certified Lactation Consultant credential have met the most stringent qualifications and work to advance the health and well-being of mothers and children around the world by protecting, promoting, and supporting breastfeeding.
The roots of the profession come from the mother support background, such as La Leche League leaders and Australian Breastfeeding Association leaders. However, over the years, most of the IBCLCs have a background as a nurse, a midwife, a dietitian, or a physician, although mother support group leaders do continue to seek the certification. In order to become an IBCLC, all candidates must have higher education in a wide variety of subjects such as human anatomy and physiology, statistics, psychology, counseling, and professional ethics, just to name a few. The International Board Certified Lactation Consultant credential is the premier and only certification in lactation consulting worldwide.
Those who hold the credential are highly trained professionals who help mothers understand the health benefits of breastfeeding, provide how-to assistance, and support mothers through the challenging issues that sometimes arise. In addition to clinical and educational services, International Board Certified Lactation Consultants are involved in research and program and policy development.
Their unique training affords them the opportunity to offer new mothers appropriate reassurance and confidence when learning the art of breastfeeding. Often, they make the difference between success and failure. And it's not just my opinion. The Centers for Disease Control calls IBCLCs the standard professional member of the healthcare team for complex breastfeeding problems and lactation management. The Academy of Breastfeeding Medicine takes it a step further. They recommend that every hospital have IBCLCs as part of the multidisciplinary team to support breastfeeding, and that if there are problems with breastfeeding, that mother-infant pair be seen by an IBCLC.
Exclusive breastfeeding is a highly effective public health intervention to prevent ear, gastrointestinal, and respiratory infections, obesity, diabetes, and cancer. In addition, breastfeeding is environmentally friendly, eliminating the need to purchase prepackaged containers of formula.
Basically, it's about benefits, or to put it another way, it's about the risks of not breastfeeding. So breastfeeding has overwhelming health benefits for mothers and infants, economic benefits for families and societies. A perfect example is a recent study in which Harvard researchers concluded that if 90% of the infants in the United States were breastfed exclusively for just 6 months, the savings would be enormous, over $13 billion and 900 lives saved per year. And this was a conservative estimate, and it didn't take into account nurturing, bonding, and infant development.
I know that there is a lot of protection that breast milk provides babies against even just regular colds and everything. It was good to know that he would get that protection from me, which is more than formula can provide. It's also the most essential nutrients that a baby needs, and it's in such an available form. So I see breastfeeding as easier than providing a bottle, than having to get up in the middle of the night and warm milk and mix it and do it in the right portions. I just sit up and breastfeed.
In the Blueprint for Action on Breastfeeding, former United States Surgeon General Dr. David Satcher said, "Together we can shape a future in which mothers can feel comfortable and free to breastfeed their infants without societal hindrances." He calls for breastfeeding mothers to have access to comprehensive, up-to-date, and culturally tailored lactation services provided by trained health professionals, including International Board-Certified Lactation Consultants. The United States Breastfeeding Committee states that obstacles and constraints to exclusive breastfeeding include insufficient numbers of providers skilled in both clinical and social support. International board-certified lactation consultants are the health professionals who provide this expertise when needed.
There's times that you have moments that you're just like, I need help, and the formula is unfortunately way too available, and sometimes it's easy to think, I'm just not going to do this anymore. But having help from an IBCLC really made it possible for me to see, you know, this is worth doing, and my problem is not that big, and we can keep going and be successful.
International board-certified lactation consultants are typically found in hospitals, birthing centers, doctors' offices, community clinics, and private practices. The International Board of Lactation Consultant Examiners wants to improve the quality and increase the number of practitioners in lactation and breastfeeding care. There should be enough of these practitioners so that every woman who needs an international board-certified lactation consultant will have access to one.
The IBCLC works very closely with the other members of the healthcare team, and yet the lactation consultant is always focused on the mother and the baby as a couplet. Whether either one or both are in the hospital or not, the lactation consultant needs to know what's going on with both the mom and the baby. The lactation consultant always keeps both mother and baby in mind, and drawing on that wide body of knowledge about breastfeeding and lactation to ensure that breastfeeding is going to succeed for as long as possible and as safely as possible.
The in-hospital visits were wonderful because somebody could see me, but I've also been able to call and ask questions whenever I needed to, which helped when I got tired and frustrated and wasn't sure that we were doing things correctly. I wanted quality time with my baby. I know that breast milk is the best thing for him, but it also allowed us just to spend time together in a way that I have enjoyed so much, and it means so much more to me than just feeding him with a bottle and letting him sit and hold it himself. I love that time that we cuddle and enjoy together.
All of my work is driven by a vision that I have, that I hope all women will have the same heritage that I have. I come from an unbroken line of breastfed children. My grandmother breastfed my mother breastfed me, and I breastfed all of my children, and I want all women to have that same heritage. International board-certified lactation consultants are key to making that dream come true. Every mother and baby that needs an IBCLC deserves to have ready and affordable access to an IBCLC. And IBCLCs deserve to be recognized and valued as essential members of the maternal-child health team. The International Board Certified Lactation Consultant care should be a national public health priority.
The International Board of Lactation Consultant Examiners is committed to sharing the message that breastfeeding saves lives, money, and the environment. It is imperative that our society support and protect breastfeeding. International board-certified lactation consultants are available to help mothers give themselves and their children the priceless gift of breastfeeding. To learn more about becoming an International Board-Certified Lactation Consultant, visit us at IBLCE.org.